Hi, hello. So we're going to be talking about PNF techniques, and so we have our patient lying on our side as we're going to be starting on scapular and pelvic patterns. And so the way this first works is we're doing these techniques to facilitate movement in a functional plane with the PNF pattern. And so in performing this motion in the upper and lower extremity, first we're going to start with at the scapula, making sure to use our lumbrical grip. And so I'm going to get into the plane of D1. And so, making sure you can see this, I'm going to move my patient's scapula into that anterior elevation and posterior depression. Again, moving in that position, making sure to stabilize so that they're supported. And then getting into the plane of D2, we're going to move our patient into this anterior depression and posterior elevation. So, again. Okay. And then for the lower extremity at the pelvis, again, now since we're in the plane of D2, we can move them into that anterior depression, posterior elevation again. Helping facilitate that movement. And then again, we can go in the plane of D1 and move into that anterior elevation and posterior depression. Okay. Now I'm going to ask my patient, can you come up and have a seat? All right. So now we're going to move into the various techniques that we can use to facilitate certain movements, typically with like initiating or even strengthening a muscle. The first of the techniques is a combination of isotonics, where we're going to have the patient, okay, so I'm going to grab your elbow, help stabilize you here. We're going to be working on flexion and extension. And so what we're going to do here is you're going to move. I'm going to push your arm down, and I want you to bring it all the way up into your shoulder, okay?
Okay.
So, all right, resist me up here. Bring it up, all the way up.
All the way up.
Yep. Now, don't let me move you. We're going to resist right here. Okay. Resist. Okay. And now I want you to resist me going all the way down. So push your arm down and resist me. Yep. Okay. Good job. And now this is a good movement for strengthening of their elbow. Next, we're going to move into rhythmic initiation. And so the way this works is we're going to move our patient through a motion. So again, flexion and extension. The way this is going to work is I'm going to bring your arm through this motion. You can just relax passively. Just let me do it. Relax for me. Yep. Okay. So we're going to start moving you through this motion. And now slowly, I want you to still let me do most of the work, but now gradually help me. So yep, you start moving. Yep, there you go. All right. And now I want you to do all of the movement, okay? I'm going to let go. Okay. So this helps train this motor pattern and allows for initiation of the movement. Next, we're going to do rhythmic stabilization. So what I want you to do is hold your arm out like this. Yep. Stabilize it. Bring that scapula back just a little bit. Okay. So I'm just going to apply some pushes on your hand. I want you to just stabilize and don't let me move you, okay? Good. All right, good. And so this will allow for increasing stability and strength of that movement. Next, we're going to do repeated contractions. And so the way that this works is I'm going to grab your arm here. We're going to do flexion and extension. The way this is going to work is we're going to start fully extended. I want you to bring your arm all the way through this motion, and I'm just going to pull it down a couple times, and I just want you to keep going through that motion, okay?
Okay.
All right, so start pulling up. Keep going. Keep going. Okay. All righty. So, again, that is good for strengthening for that movement. Now we're going to do reversal of antagonist. And so the way that this is going to work is what we're going to do is you're going to bring your arm all the way up into flexion and all the way up into extension, right?
Okay.
And, excuse me, I was going to do wrong. You're going to bring your arm all the way up into flexion, right? Mm-hmm. And then I'm going to push on it, and then I want you to So you're gonna bring your arm into flexion. I'm gonna push on it, and then you're gonna relax, and it's gonna let your arm come all the way up naturally. So
Okay.
after I'm pushing on it, I want you to just allow your arm to come into flexion. Okay.
Okay.
All right. So I'm push down. All right. Now flex your elbow. Okay. Good. All right. And so again, that'll allow for strengthening of that movement. Next, we're going to do slow reversals. And so the way that this works is now I'm going to push and bring your arm back a little bit. Yep. I'm going to push on your elbow, and then I want you to. So you're just going to resist me, and then we're going to shift, and I'm going to push on your arm here, and I want you to resist me here, and we're going to push, and I want you to keep resisting me. Okay.
Okay.
All right. So push down. All right. Resist me. Okay. Now resist me here. Resist me here. Okay, now resist me here. Okay, nice. Good job. Okay, and so that was slow reversals. Next, I'm sorry, that was alternating isometrics. So next, we are going to do contract, relax, where we are going to facilitate movement in one direction. And so the way that this is going to work is we are going to allow for the flexion movement to occur. So we're going to essentially stretch the essentially the tricep, and so we are going to we're allowing for elbow flexion to occur, so we're going to work on the antagonist to allow for that. So the way that this is going to work is I want you to push down into my hand, all right, and then we're going to bring you into a little bit more flexion. Okay.
Okay.
All right, so push down for me. Okay, now we're going to bring you a little bit more flexion. Okay, yep, push down again. Okay, we're going to bring you a little bit further. Yep, now push down. All right, now we're going to bring you a little bit further. Okay, and so this works by inhibiting that Golgi tendon organ reciprocally on the opposite muscle, essentially homonymous muscle. Now we're going to work on the agonist, the biceps, with hold relax. And so we are going to push down on this bicep, and I want you to resist me here, and then we're going to move you into more flexion, okay?
Okay.
All right. Okay, relax. Okay, yep. Okay, relax. Okay, relax. All right. No, that's good. All right. And so now I realized that the slow reversals were just the isometric hold, where I had the patient hold. We still need to do the alternating isometrics. I don't know if I misspoke. And so with the alternating isometrics, we are going to have our patient go through this motion where they're going to resist me going into flexion, and they're going to resist me going into extension. All right. So the way this is going to work is you're going to bring your arm all the way down. I want you to resist me, and then you're going to bring your arm all the way up. I want you to resist me going that way.
Okay.
So move your arm. All right. Up. Okay, good. Now resist me going down. All right, resist me going up. All right, now resist me going down. All right, good job. Okay. Lastly, we're going to move into replication. So I'm going to have the patient, you can lie down facing this way. Okay. For this movement, we're going to have the patient practicing a supine to sit transfer. So I want you to bend your legs for me. You can kind of bring them to the side, like off the table. Okay. So first, what we're going to do, making sure you can see me, we're going to push down and have the patient resist us isometrically. So I'm going to push on you as you're trying to stand up. Okay, so resist. Yep, resist me. Okay, now immediately I'm going to bring you up into the position. Okay.
Okay.
All right. I'm bringing you up. All right, good. Now I'm going to bring you back down. Okay. Now I want you to do this motion yourself. Okay.
Right.
All right, good. Those were all the PNF skills. Thank you so much.